Good morning all medicos. This is our second video of MCQs on skull and cranial nerves from brain anatomy. Most of MCQs of this video are long and scenario based. So do not skip, subscribe our channel and grow with us. Let's begin. Question number 1. Schirmer's test evaluates the function of option A greater petrosal nerve, option B lesser petrosal nerve, option C chorda tympani nerve, option D auriculotemporal nerve. The correct answer is option A greater petrosal nerve. Schirmer's test evaluates the secretions of tears, function of lacrimal gland, which receive fiber through the greater petrosal nerve. So the correct answer is option A greater petrosal nerve, which evaluates Schirmer's test. Question number 2. Facial nerve supplies. Option A risorius muscle, option B anterior belly of digastric muscle, option C lateral pterygoid muscle, option D both A and B. The correct answer is option A risorius muscle. Facial nerve supplies muscle of facial expressions. Risorius is a muscle of facial expression and supplied by facial nerve. Anterior belly of digastric and lateral pterygoid muscle are supplied by mandibular nerve, not facial nerve. So the correct answer is option A. Question number 3. Which of the following is not supplied by secretomotor fiber of facial nerve? Option A lacrimal gland, option B parotid gland, option C submandibular gland, option D nasal gland. The answer is B parotid gland, which is not supplied by facial nerve. Glossopharyngeal nerve carries the secretomotor fibers to parotid gland, not facial nerve. Question number 4. Not supplied by cranial part of accessory nerve. Option A stylopharyngeus, option B palatopharyngeus, option C palatoglossus, option D sphingopharyngeus. The answer is option A stylopharyngeus, which is not supplied by accessory nerve. Stylopharyngeus is innervated by the glossopharyngeal nerve and not the accessory nerve. Question number 5. Ansa cervicalis supplies option A Sternohyoid, option B Mylohyoid, option C Cricothyroid, option D Stylohyoid. The correct answer is option A Sternohyoid muscle, which is supplied by Ansa cervicalis. Ansa cervicalis supplies anterior neck muscles including sternohyoid. Mylohyoid develop in first pharyngeal arch and is supplied by the inferior alveolar nerve, which is branch of mandibular nerve, and mandibular nerve is branch of trigeminal nerve, fifth nerve. And stylohyoid muscle develops in second pharyngeal arch and is supplied by the facial nerve. Question number 6. Otic ganglion is anatomically related to option A glossopharyngeal nerve, option B mandibular nerve, option C vagus nerve, option D trochlear nerve. The correct answer is B mandibular nerve. Otic ganglion is functionally related to the glossopharyngeal nerve, which carries the preganglionic fibers to the ganglion. But anatomically otic ganglion is related to the mandibular nerve, which carries postganglionic fibers to parotid salivary gland. So the correct answer is mandibular nerve, which is anatomically related to otic ganglion. Question number 7. Proprioceptive impulses for masseter reflex are carried to which nucleus of trigeminal nerve? Option A mesencephalic, option B sensory, option C motor, option D spinal. The correct answer is option A mesencephalic nucleus of trigeminal nerve. Mesencephalic nucleus of trigeminal nerve receives the proprioceptive information of masseter reflex and integrates with the motor nucleus to produce contraction of jaw elevators. Masseter reflex is a monosynaptic reflex where hitting on the mentum produce rapid stretching of the muscle like masseter and the jaw get closed. Question number 8. Center for stapedial reflex. Option A superior olivatory complex, B lateral lemniscus, C inferior colliculus, D medial geniculate body. The correct answer is option A superior olivary complex. What is acoustic reflex or stapedial reflex? In response to loud sound, contraction of the stapedius muscle stiffens the middle ear ossicles and tilts the stapes in the oval window of the cochlea. This effectively decreases the vibrational energy transmitted to the cochlea. It is a protective reflex. The best known reflex mediated through the superior olive or superior olivary complex is the stapedius reflex. Question number 9. Vertebral artery transverse all of the following except option A foramen magnum, option B subarachnoid space, option C intervertebral foramen, option D foramen transversum. The answer is option C intervertebral foramen. Vertebral artery does not pass through this foramen. Vertebral artery passes through foramina transversa of the upper six cervical vertebrae, pierce dura mater and arachnoid mater to enter the subarachnoid space, and passes through foramen magnum to enter the cranial cavity. Spinal nerves and the radicular vessels pass through the intervertebral foramen, not the vertebral artery. Question number 10. Greater petrosal nerve is formed from option A geniculate ganglion, option B plexus around ICA, option C plexus around middle meningeal artery, option D none of the above. The correct answer is option A geniculate ganglion. Greater petrosal nerve is a branch of facial nerve given at geniculate ganglion. Question number 11. In complete unilateral damage to hypoglossal nerve, all are true except option A tongue atrophy on affected side, option B deviation of tongue towards the site of lesion, option C deviation of larynx to the contralateral side during swallowing, option D loss of tactile sensation on affected side. The answer is D, which is not true. Other three options, option A, B and C are true. Tactile sensation of tongue is not carried by the hypoglossal nerve, hence there will be no loss of tactile sensation on the tongue. Option D. Hypoglossal nerve is a pure motor nerve and supplies the tongue muscle. It also carries the C1 fibers to supply the two muscle of hyoid bone, geniohyoid and thyrohyoid. Question number 12. All of the following statements about the vagus nerve are true except option A supplies heart and lung, option B carries postganglionic parasympathetic fibers, option C innervates right 2/3 of transverse colon, option D stimulates peristalsis and reflex sphincters. The answer is option B, which is not true. Cranial nerve 3, 4, 9th and 10th vagus nerve carry the preganglionic fibers, not postganglionic parasympathetic fibers. So the option B for vagus nerve is false and other three options A, C and D are true for vagus nerve. Question number 13. Facial nerve stimulation during testing of nerve indicated by contraction of muscle. Option A temporalis, option B masseter, option C sternocleidomastoid, option D orbicularis oris. The correct answer is option D orbicularis oris. Facial nerve supplies the muscle of the facial expressions like orbicularis oculi. So during testing of nerve, facial nerve stimulation indicated by contraction of orbicularis oris muscle. Muscle of mastication like masseter and temporalis are supplied by the mandibular nerve, a branch of trigeminal. Option A and B. Sternocleidomastoid supplied by accessory spinal nerve. Option C. Question number 14. A patient with crocodile tears syndrome has spontaneous lacrimation during eating due to misdirection of regenerating autonomic nerve fibers. The lesion is located at option A facial nerve proximal to the geniculate ganglion, option B chorda tympani in the infratemporal fossa, option C facial nerve at the stylomastoid foramen, option D lacrimal nerve. The correct answer is option A facial nerve proximal to the geniculate ganglion. Crocodile tear syndrome, Bogard syndrome, is spontaneous lacrimation during eating caused by a lesion of the facial nerve proximal to the geniculate ganglion. It follows facial paralysis and is due to misdirection of regenerating parasympathetic fibers, which formerly innervated the salivary, submandibular and sublingual glands to the lacrimal gland. Question number 15. Mass in jugular foramen may result in all except option A difficulty in swallowing, B hoarseness, C. Difficulty in turning the neck to opposite side. D. Tongue deviates to the same side. The answer is D. Tongue deviates to the same side is not true. All other are result of mass in jugular foramen. Muscles of tongue are supplied by hypoglossal nerve, and hypoglossal nerve passes through hypoglossal canal, not from jugular foramen. Jugular foramen has cranial nerves 9, 10 and 11 passing through it, which supplies the muscle of palate, pharynx and larynx for speed and swelling. So, for mass in jugular foramen may result in difficulty in swallowing, hoarseness, difficulty in turning the neck to the opposite side, but not affect the action of tongue muscle. Maximum of these questions are scenario based and long question, but I put explanation of all these questions, so read them again and understand and memorize. Subscribe our channel, like our work and share it with your friends, your colleagues and grow with us. I will make videos on scenario based MCQs in coming days, so for more videos subscribe our channel and keep reading, keep growing.